My name is Doug Smale, CEREC Doctor's mentor and visiting faculty. I get a lot of questions about Densah Burs when I mentor the Level 6 course at CEREC Doctors. I made this video to help people understand the different ways Densah Burs can be used for implant osteotomies in a guided surgery format. The pre-surgical planning is the same for any typical guided surgery case. Bring your CEREC scan in, align the implants to the crown proposals, and send the data for whatever guide you want, SciCat, Digital Guide, CEREC Guide 2, etc. In this case, we had to angle the implant slightly to avoid the root of number 22 in the metal foramen. Make a note of the bone density and presence or absence of the cortical bone. This is important deciding how to use the Densah Burs. In this case, the buccal cortex is thin in both areas and will need expansion and preservation of the buccal bone to allow for appropriate thickness after placement. I'll be using the Densah Burs mostly in the reverse or densifying mode. A typical papilla-sparing crestal incision and flap was used, and the guide was modified on the buccal to allow for maximum irrigation during drilling. This is essential and very important for success. These happen to be Nobel implants, so I started with their pilot burrs, but you can use the Densah pilot burr or whatever implant brand burrs for the implant you are planning to place. I do an overlapping protocol with the Densah Burs, 1525, 1828, 2535, etc., along with copious irrigation and a pistoning up and down movement to get good expansion and densification without overheating the bone. After the final 2535 Densah Bur was used, the bone is white with densified bone. I wait at least a full minute for blood to start seeping in from the osteotomy walls before I place the implant through the guide. The implants went in at 42 Newton centimeters of insertion torque, which is great. And carver screws were placed and primary closure was done. The Panorex here confirms correct placement. Densah Burs are a great tool to have in your implant armamentarium to help keep and expand precious alveolar bone. Like anything we do, there is a learning curve and you can't be overly aggressive. So if you have any other questions, please message me on the boards. Thanks.